Toyin Ajayi, a doctor and CEO, she grew up in Nairobi, where her parents taught her that if you have privilege, you use it to help others. After completing medical school, she went to Sierra Leone to work to improve a pediatric hospital, but it had no running water. So before she could treat patients, she worked to fix the pipes. That's where she learned the lesson that to drive real change, you have to fix the root problem first. Later, when working as a doctor in Boston, she saw many people were unable to access or trust the healthcare system. So she founded City Block Health, bringing care to people where they are in homes and communities, and addressing what truly drives health: food, housing, and trust. A 2025 CNBC Changemaker, Toyin Ajayi is in the Changemakers and Power Players spotlight. Toyin, thank you so much for joining me on our Changemakers and Power Players podcast. I'm so excited to talk to you because I got to know your story very well when I was writing my book, When Women Lead. And we spent a lot of time on Zoom talking during the pandemic about your story, your leadership style. And there is something that you said in our interviews and something you talked about in terms of how you approach problems that I think about almost every single day. It's this concept of fixing the water supply. And you told me the story of when you went to Sierra Leone and your job was to fix this pediatric hospital and help children in Sierra Leone by improving the pediatric hospital. And you got there and you realized that the plumbing was broken and there was no running water in this pediatric hospital in Sierra Leone. And even though your job was to go there and do medical stuff and be a doctor, you realized you couldn't do anything until you fix the water supply. And I think about this every day. What's the water supply that needs to be fixed? What's the issue that seems like it's unrelated to what I'm supposed to be doing, but is actually essential for me to get anything done? So thank you, Toyin, for giving me that, because I think about it all the time and I reference it. And I think it's such an important part of leadership to take a step back and say, what is my job really right now? And how do I need to think differently about this problem to actually accomplish anything? So thank you.
Oh my God, it's such a pleasure. And I'm so glad that resonated with you. I do think it's especially for people like us who are trying to do big things and complicated things. I think understanding the context and getting as far upstream as possible and then figuring out how it all connects is such an important part of problem solving. Before we get down into the silos and into the weeds of the supposed mission, really understanding how it all fits together is that's always been sort of the way my brain likes to work.
It's incredible. So, and I want to talk about your current business, City Block Health, which we named to our Disruptor 50 list. Of course, we named you a CNBC Changemaker. But I want to go back to your origin story because I think it explains a lot about how you approach problems, why you lead the way you do. What was the start?
Yeah, I think, I wish I could say that there was a clear planned out journey in advance, but I think so many honest stories about people's careers are that they're just opportunistic choices you make. And some work out and you learn no matter what. And so for me, I had a very close friend in grad school who, after we finished our master's degrees, he moved to Sierra Leone to work for the United Nations on international development work. And he found a community of people who were young from all over the world, trying really hard through nonprofits, the World Bank, and other avenues to try to help this country that was about a decade now after a really, really devastating civil war, trying to rebuild. And he kept sort of, trying to attract me to come and spend time. The healthcare system needed a lot of help. I figured I would learn something. I'd grown up in Africa, but in a city. I'd never spent a lot of time in a rural area.
And you had grown up in Nairobi?
In Nairobi, in Kenya. And I decided in my final year of medical school to spend 3 months in a rural part of Sierra Leone, learning and interning. And as it turned out, it was a totally life-changing experience, very challenging. There was no infrastructure. There were few resources. I came at a time when the country was really in this very, very pivotal, very fragile state after the war, after a lot of the international nonprofits that were providing aid, including Doctors Without Borders, MSF, had left. And sort of the country was trying to pick things up on its own and had found that all these infrastructure and these systems had totally eroded. And I saw a lot of death. I saw a lot of suffering, profound suffering. And I was both, I think, eager to leave and go back to my life and process the traumas that I had vicariously experienced, but also very motivated and inspired to think about how I could be part of a solution. And so made a little bit of an atypical choice after finishing medical school before starting residency or postgraduate training to actually move there, and build a nonprofit that focused on this one hospital initially and figured we'd take something bite-sized and see if we could try to improve the quality of care for children in this pediatric hospital. And I was, like, I think many people who do this kind of work, honestly, woefully underskilled for it, totally unprepared, but had a lot of energy and a lot of passion, and a curiosity to try to figure out what the root causes are and kind of, I think also a little bit of, confidence in my ability to problem solve that I just went for it. But that's how I ended up there.
How did your parents influence you and your desire to not just do well, but also do good?
Yeah, my parents were really, in retrospect, really remarkable approach to parenting. So I'm the eldest of three girls, and they treated us like equals. We had very mature adult conversations at the dinner table. I grew up in Kenya in the 1980s and 1990s, so the height of the AIDS epidemic globally. Everywhere we looked, we saw the evidence of this horrible, horrible, horrible pandemic. We saw children hungry, orphaned on the streets. We personally knew people who were impacted and affected. There was a massive influx of donor international aid money into Kenya. But it was very clear that there were sort of two things outside of our quite privileged life that were impacting people profoundly. There was maternal and child health, and the maternal mortality and child morbidity, and there was the AIDS epidemic. We were also in the middle of transition from colonialism to independence to what became an autocracy for a while. So there's a sort of broader political climate. But my parents were very transparent with me and my sisters. They would say things like, you know, for most women in Africa, the biggest risk to your life is getting pregnant and having a child. At that time, somewhere between 1 in 6 and 1 in 16 women had a serious complication in childbirth, and many of them died. And he would say, and my dad would say, you're just lucky you happen to be born here to us. And to parents who are master's educated and can send you to school and who give you choices and can teach you about your life and your bodies. 1 in 4 at some point adults had HIV, and there was this massive, massive, as they said, number of children who were orphaned from that disease. And they would be like, you just got lucky. You did nothing to deserve this. And so we, from a very early age, understood that we were fortunate, and we were fortunate by virtue of our birth, not because we earned it, and that we had an obligation to understand what that privilege meant and what the responsibility came with that. We volunteered from a very young age. I was I was probably 16 or 17 in my final years of high school, volunteering with an organization for women with AIDS, where I would go into the slums and sit with women who were dying of AIDS and try to help them with food and basic things, knowing that there was no treatment for this. All at the same time, I remember vividly there was a global conversation when antiretroviral drugs became available about how, if first and then how, we could make them affordable for developing countries. And I remember watching a news segment where there was a debate about whether it was cost effective to make antiretroviral life-saving treatments available to people in Africa. And somebody said, well, I mean, their lives are bad enough as it is. And many of them can't tell time anyway. How could they take these medicines? And I was like, they are me. Like, this is like, what are you talking about? And I just remember feeling so angered and indignant and determined that was not the way that we as a society should think about the allocation of resources. And I felt diminished, but also enraged. And I think my parents did a really good job of instilling in my sisters and I the belief that we could be change agents and that we were sort of obligated to do so. And that sort of rage turns into fire in your belly, turns into motivation, turns into inspiration when you have tools like we did. We had great education and we had parents who really pushed us.
Well, I mean, it's incredible, this idea of how do you take that anger, that rage, and turn it into your own ability to drive change. When I reflect on our conversations during the pandemic for my book, I think a lot about how you're very empathy driven and how you had an incredible amount of humility and understanding how to help people and drive change. And you told me the story about how parents were afraid to come into the hospital and bring in their children because their children were close to death and they didn't trust that you were going to actually be able to help their kids. And you thought that they thought you might actually end up hastening their death. But yet they trusted the local medicine woman who was giving out these sort of solutions that were not medical, and how that totally changed your understanding of how to approach problems. Because I think that's actually a huge part of why City Black Health works the way it does today. Tell me about that experience, because that story was so powerful to me in explaining why you're so humble in your approach to problem solving.
Yeah, I mean, I was humbled. It was very humbling, because so what happened was that we'd spent several years at this point improving the sort of infrastructure in the hospital. So went from there was no running water, we didn't have oxygen, we didn't have an intensive care unit, hardly any medicines, no doctors on call overnight, to, an intensive care unit, oxygen, water running, an x-ray. We've done all this stuff over years of working to sort of put together what looks like a good hospital, right? And it sits right in the middle of the capital city. It's within walking distance of hundreds of thousands, maybe even 1 million people. Healthcare was free for kids under the age of 5. We're like, we built it. You should come, and like feeling pretty good about things. And I went back, and at this point I was in residency. I went back and did an audit, and I was like, let's look at the data now. So let's see if what we believed to be true is true. We've taken this hospital that had an abysmal infrastructure. We've now upgraded that meaningfully. At that point, we had a residency program for pediatricians. We were really doing stuff. And we looked at the data, and actually it had hardly changed. 1 in 4 kids who came into the hospital died. And about half of the kids who were brought into the hospital were sort of on death's door, based on their vital signs. They were so sick. And I looked at it and I was like, oh my God, like it would appear that all of this effort and time had not changed anything. So I started asking questions of my colleagues and sort of nurses, doctors, and everybody had an explanation that effectively, when I listened to it, put the blame on patients and parents. These mothers are not educated. They don't know that their kid is sick, so they wait until it's too late to bring them in. They have so many children, they don't value their children, and they don't want to spend the time or the energy coming. It's too far away for them to come. Like all these explanations that just didn't sound right. And I guess, my fundamental belief is that we all, as humans, want, by and large, the same things. We want to thrive. We want to be able to see our families thrive. We want to have autonomy. We want to have choices. We want to feel healthy and empowered. So why are people behaving in ways that appear to be sort of counter to their best interests? And it cannot be that they're stupid. I don't believe that. I don't believe that just because you didn't have a high school education, or that you don't fundamentally understand what feels good to you and what health and well-being means. So I said, well, let's actually talk to people. Let's survey people. And so we went out and put a call for a conversation, asked parents. We asked anyone who cares for children to come and meet us and talk to us and tell us what they think is going on. And it was fascinating. I mean, they said things like, well, sure, when we come into the hospital, the first thing that happens is you talk to me, but then you make me wait. And you don't explain to me why I'm waiting. And I see people who come in after me get seen before me. Now, we know this in healthcare. This is triage. We're prioritizing the sickest kids. We never bothered to explain it to people. So they saw this sort of opaque system that felt discriminatory. They said the nurses berate us and they make us feel bad. They lecture us and they tell us that we were careless with our children when we come in and they're sick. And they don't wear name tags. And so we don't even know how to hold them accountable. They said, when my child is unwell, I know the symptoms. I know what it is. They're not eating. They're fussy. They're had vomiting or diarrhea. They knew exactly what sickness was. But they said, but I go to the person who I trust. Well, who do you trust? I trust the midwife who delivered me. I trust the nurse at the local community clinic. I trust my aunt or my grandmother or my healer or the person on the side of the street who's selling herbs and sometimes gives me things on credit because they know I can't afford it. I go there first. That's why the kids were coming in really sick because they didn't trust us. And they said, and by the way, we watch what happens. People come in and and then they come out with the corpses of their children. They didn't understand. They're like, whenever you put the oxygen thing on the person, half the time they die. And we were like, well, that's because they're very sick. But they didn't understand that either. We had not spent the time to go to people, to explain to them what we were doing, to give them agency and choice, and we were not accountable. And for me, the lesson was it's not enough to have good intentions. It's not enough to have infrastructure. In healthcare, it is not enough to build it and expect people to come. You have to go to them. You have to meet them on their terms. You have to solve for what they're solving for. And you have to understand that people are making choices, even in the most dire circumstances. You could be a mother of 6 children in rural Sierra Leone with $1 a day to live on. You still have agency. And your time and where you take your child when they're sick is an expression of who you trust. And so like earning that trust was so important. And sort of the irony is I went from there back to Boston, the sort of bastion of medical technology and education. At that point, we had free healthcare for everyone and free health insurance, universal health coverage. So this is before the Affordable Care Act, but Massachusetts had built a system to ensure health coverage for people. Incredible hospitals, incredible doctors, community health centers that were accessible. And still, I had patients who came in late stages of illness. I had a woman who came in with cancer growing out of her breast that she'd had for months and months and months, who was too scared to come to the doctor because the last time she'd come, she had a terrible experience. And it was like, I've seen this before and we're doing the same thing again.
And so here you are in Boston, bastion of medical, healthcare, and technology, and you're seeing that fundamentally the same issues as you saw in Sierra Leone. Um, tell me a little bit about how that inspired you to found City Block Health and why you had the confidence to apply this big picture problem solving approach um, to healthcare as opposed to just treating the individual patient and sending them on their way. Why it was so important to create a system like City Block that doesn't just treat the patient, it does so much more than that.
Yeah, I mean, I think like most people who go into healthcare, I decided to be a doctor because I wanted to help people and I wanted to be able to support people in their most challenging moments, have a better outcome. And it was very clear to me that unless we actually solved the fundamental problem, I would be doing the same thing I was doing in Sierra Leone, which is like treating sick kid after sick kid after sick kid. And then looking back and saying, actually, the data hasn't changed as a society. We're no healthier. And we haven't changed patterns of use of the healthcare system. We haven't addressed the underlying issue. And there are so many underlying issues in our healthcare system today. I don't mean to sort of reduce or oversimplify, but a fundamental issue is that we have built healthcare systems and we expect people to come to us and we only care for the people who show up. And it felt to me like we needed kind of a radical overhaul of, first of all, what do we believe our jobs are in healthcare? Is my job to sit in a clinic and wait for people to come to me and take care of them the best I can in the 10 minutes I have? Or is my job to actually go out and find people and help understand what's driving their health and their well-being and put in place solutions to help them live healthier lives? And if I believe it is the latter, which I do believe, if I really want to see humans and societies be healthier, then I got to get out of the clinic and we've got to build systems that go to people in a much more proactive way and that think about those who are the most likely to get left behind and that disproportionately, therefore, invests in caring for them. And so that's what I believed needed to happen. I didn't see it happening very much in our healthcare system. And I knew that if I kind of stayed within the 4 walls of an academic medical center or a traditional medical practice, that I would likely look back on a career that may have been fulfilling in some ways, was certainly full of like really incredible individual stories, but that didn't actually contribute to changing the way that we deliver healthcare and therefore to changing the way that people experience their health in their lives. And I really wanted that. I wanted that big thing.
That's the thing that I think I want to learn from, and I want other people to learn from, is this question of how do you not just do good, but actually decide you're not gonna be constrained by the way things have always been done to enact systemic change. When you were in Boston working in a high-tech hospital, helping these patients who had been too afraid to come in, I remember you telling me sometimes you would treat homeless people and then release them out to the street where they couldn't maintain their health. What gave you the confidence or the conviction that you were gonna be able to create something that addressed the systemic issues as opposed to just putting the Band-Aid on the problem? How can we learn from your, confidence to inspire, that you could drive change?
It's a really interesting question. I don't have a great answer. Like, usually I'm sort of a little flip about it. I'm like, it's a perfect alchemy of like naivete and hubris, right? Like, there's this sort of like, I think the thing that I find almost universally true amongst people who are change makers and entrepreneurs is that you have this fundamental belief that you can actually make things better and different, and that we are not constrained by the status quo simply because it's the status quo. And I don't know exactly where that came from. But I think that, especially as a young person, I love that you asked me so much about my upbringing because I think it matters a lot how we inculcate young people. But if we educate young people with um, a sense of history, right? Like all the things we enjoy and take for granted today didn't exist one time. Someone dreamed them into existence. Everything that we do was dreamed into existence by somebody who had never seen the thing they built. Like, and like think about that in sort of like a macro scale. So I think that's one is like education that really allows people to understand that every tangible part of our lives was created by a human being at some point, right? Um, and and also then allows people to test and iterate and sort of push those boundaries, right? And that feedback loop of like, well, there was this thing that didn't exist that I then built. There was this idea that I had that I then created. There was this hospital in Sierra Leone that had no running water that I then contributed to making running water. Like it is possible to do that. And you just sort of amplify that. That builds a sense of confidence and agency and a sense of being unconstrained by the world in its current state. If it does not suit me, or it doesn't feel right, or it doesn't suit the people or the issues that I care about, why don't we change it? And then I think there's a piece around this sort of humility and the curiosity that allows you to then pull at the string. And you were so kind as to sort of to talk to me about that example of the water. Like I literally, not a plumber, drew a map. I was like, explain it to me, and I will draw a schematic of like the water comes in from here. This is the tower. These are the like, and then we will just go through each step and figure out where it's broken. And every problem is like that, right? Like but you've got to be willing and curious and tenacious and patient and humble enough to recruit help to help you understand all the different steps along the way. And then you diagnose it and you start to do things.
How do you see City Black Health as really trying to create a systemic alternative to the problems in the healthcare system today?
The first thing that I think is critical is the understanding that health happens outside of the doctor's office in the hospital, and that people exist in their fullest forms in all those hours and minutes of the day when they're not directly interacting with the healthcare system, and that we've got to go find them. And the people who need us the most often have the biggest constraints on their time and their access. And so if our goal is to make healthcare accessible to all people, and particularly to those who have the most to gain and the most to lose from the quality of the care that they get, we have to go to them, and we've got to figure out what actually matters to them. And we've got to be willing to understand and address all of the drivers of care and of health. And so for us, that means finding people wherever they are in their home, in the community, in the shelter, on a park bench, in the hospital, if that's where they are, um, taking the time to earn their trust and to fully understand what matters to them and what drives them and what they need, and then actually solving those gaps. And for many people, it is things like food, or I don't know how I'm going to get to my oncology appointment that I know I need, but I have no transportation, or I need help figuring out childcare, or actually this whole set of instructions that I was given for my colonoscopy is too complicated. I don't understand it. I need somebody to explain it to me. Or I know I'm supposed to be on a special diet for my heart disease and my diabetes, but I actually don't know what those foods mean in my culture. What is a low carb diet if I'm used to eating, rice and beans and tacos? Can you help me understand what that means? It's those types of things, as much as it is access to healthcare that makes people feel cared for and seen and not judged, and that is real time available 24/7. And so that's what we built. And we built it with the notion that we should be accountable for healthcare outcomes, not just for utilization. So most traditional healthcare systems, the doctor, the hospital gets paid when the patient is seen. Doesn't matter if they got better. Doesn't matter if they actually filled the prescription that was written for them. Doesn't matter if they went from the doctor's office straight to the emergency room for the same problem. We still get paid. Maybe when I write that prescription, I should call you.
So you're saying that traditionally in medical systems, doctors are not paid based on outcomes, they're paid based on the volume of care. And so, right, City Black Health, you're reversing that system to ensure that you're compensated mostly by Medicare, I believe, based
And
on
Medicaid.
and
Yeah,
Medicaid, based on how healthy people are.
that's right. That's
And
exactly right.
but so what I was saying is that there's so much distrust in healthcare right now. It seems like we're seeing declining rates of vaccinations and really growing distrust of medicine. Uh, how does that impact your business at City Block Health? And what does it mean for the healthcare system as a whole?
Yeah, I think we're in a really, really interesting moment for the healthcare system as a whole. I think for us at City Block, it makes the work we do all the more important, honestly, and all the more um, singular, frankly, because we started from the very beginning of this business. We've been at this for 8 years now. From the very beginning, we said to our investors, our shareholders, our teams, the most important thing that we have to figure out how to do is how to earn and retain the trust of people who have lots of reason to be mistrustful of the healthcare system. And so we spent a ton of time and energy building systems and building ways of operating that were engendering of trust and not taking for granted that if we build it, they will come and they'll be delighted and they'll do what we ask them to do, but actually going the extra mile to figure out what does it look like to earn that trust and to retain that trust over time so that people can make choices based on the information that we're sharing with them and based on the tools that we're offering to them. It's been really interesting, but I have to say not at all surprising to me that broadly speaking, trust in the healthcare system is at an all-time low in the United States. That is worse even for people who are lower income, people who have complex healthcare needs, people who have actually reason to interact frequently with the healthcare system. And that this widespread issue of kind of who do I trust? What is truth? What is best practice? What does the sort of historical academy of medicine and the publications that we rely on, what does that actually mean to me as a human? These are all questions that people are asking. And it doesn't surprise me because I think we've done the same thing um, with medical information as we have done with medical care, which is like we build it and they will come. And why will they come? Just because. Even if it's not relatable, if it's not fully explained, even if it's not free of conflict or bias, we just expect people to listen to us and to believe us and to trust us because we said so and we're here and we've got MD behind our name. And I just don't believe that. I think that humans deserve to be spoken to and communicated with as though they are fully empowered and enabled, as though they are equal. Because I say to my patients, I'm an expert in these things. You're an expert in you. You're an expert in what it feels like to be you every day. And you bring your expertise and I bring mine. And mine is by no means more important than yours. I cannot tell you how you're feeling. You can tell me how you're feeling. I can't tell you how this sounds to you, this proposal I'm putting in front of you about a treatment plan. You have to tell me that. I can't tell you if it's working. You will tell me if it's working. I'll show you what I see. You tell me how that feels. And like we haven't really done that. Medicine for so long kind of operated on a hierarchy. It was us and it was them. We had the white coats and all the data and the information, all the years of training, and they were our subjects. And they either did what we told them to, or they didn't, they, the patient. And if they didn't, we would blame them. We would say they were uneducated, they are non-compliant, they didn't follow through. That doesn't work. And I think that we have a real opportunity in healthcare and in public health to regain trust by actually meeting people where they are, in the ways that we try to do at City Block, sort of physically in their homes. In today's world, that means in their smartphones, on their feeds, wherever people are, we've got to go there. And we've got to show up using language that is relatable to them and intelligible to them. We have to earn their trust by over and over and over again demonstrating that we know what we're saying and that what we do, what we say we do, and we follow through, and that we have their best interests at heart. And we have to, and metaphorically meet people where they are, as well as physically. And so I think this is both sad to see in many ways, because I think a lot of people are struggling to figure out what they should do in order to improve their health and their well-being and live their best lives and care for their children and their families. But I think that we, in the healthcare, as the healthcare professions and systems, have a lot of work to do to regain that trust and to earn some standing in the pantheon of tools and systems and data and information that's available to people.
I know City Block has been growing very quickly, has been, expanding and treating and helping so many people, but there's so much under attack right now in the healthcare system. Medicare and Medicaid under attack. You describe this as an opportunity. Why are you not disheartened? What makes you optimistic? You said you're optimistic. What makes you optimistic rather than feeling like you should give up because the challenges are so intense in a country where there's been a broken healthcare system for so long?
Yeah, I mean, it is. I think a couple reasons for optimism. I think the first is we're in a moment where health and healthcare and what it means to be healthy is the subject of a national discussion. Um, I've never seen that. I mean, we have the Make America Healthy Again movement. Actually, a movement. There are people who identify as being part of a movement around health. That's incredible. We're having a discussion about um, whether or not I agree with certain people's positions. Who can I elect who is more likely to help me live a healthy life and help my children live a healthy life? That's incredible. This is as important an issue as any other issue. And for the first time, certainly in the last couple of decades, people are having real conversations, not in the halls of Congress, not in the state houses, but actually on the ground about what health means. So that's thing one. Thing two that gives me optimism is it's not like the status quo was working for anybody. Healthcare is so unaffordable in the United States, like inexplicably unaffordable. We're not healthier as a result of all the spending we're making. We as a country spend more per capita on healthcare than any other developed country, and we have some of the worst health outcomes. Doctors and nurses are burned out. They're leaving the profession in droves. We're having a hard time attracting people to do really amazing work, like being primary care doctors in rural areas. We can't find people who want to do that work. And we're aging, and the needs are greater. And at the same time, the sort of the medical knowledge and breakthroughs that we have access to are just, they're tremendous. And so I see this as like, okay, so the status quo wasn't working. Everybody's kind of mad about it. No one feels great about our healthcare system. We're talking about it. We're making like policy decisions on the basis of this. This is exactly the opportunity to start to put together a vision for our future that is better, that's rooted in data, that's rooted in evidence, that's rooted in science, that is humble enough to acknowledge what we don't know, that speaks to actual people, that is like deserving of their trust and their buy-in, and that can actually move the needle forward for people. Like it's incredible.
Well, that's a perfect note to end on. I think about your advice about how to fix the water supply whenever I have a kid melting down or a challenge at work. What is the fundamental issue that needs to be solved? And I think this idea of doing a personal audit. I know what my values are and what my mission is, but I feel like we could all benefit from taking that time to just make sure that we're keeping on track. Toyin, thank you so much. I really appreciate it, and I know that you're doing so much in your work, but I also feel like your message has been so valuable to me and hopefully other women who want to and men who want to drive change.
Thank you so much.